2026 Social Security COLA increase. What seniors need to know. Imagine waking up one day to find that your Social Security benefits have increased, but the excitement is short-lived as you realize that a significant chunk of it will be gobbled up by rising Medicare Part B premiums. This is the harsh reality that many Social Security recipients may face in 2026, with an estimated 2.7% cost of living adjustment COLA that may not even cover the increasing costs of healthcare. But here's where it gets controversial. The latest inflation report suggests that the COLA for 2026 could be higher than initially thought, with a 2.7% increase, up from the previous estimate of 2.5%. However, this increase may not be enough to keep up with the rising costs of Medicare Part B, which is expected to increase by 11.6% in 2026. The Consumer Price Index for urban wage earners and clerical workers, CPIW, which is used to calculate the annual adjustment to Social Security benefits, gained 2.6% in June, while overall inflation rose 2.7%. The Federal Reserve's inflation goal is 2%, but it seems that the current inflation rate is still higher than that. A cost of living adjustment, or COLA, is meant to help Americans keep up with inflation so they can maintain their standard of living year to year. However, the hikes are falling short, especially when Medicare premiums are rising at a faster clip. As Mary Johnson, an independent Social Security and Medicare policy analyst, notes, it's not uncommon for Part B premiums to consume much or even all of the annual COLA, leaving little extra to cover other big cost increases. The Medicare Part B premium for 2026 is expected to increase to $206.50 from $185 in 2025 for a jump of $21.50 per month, or 11.6%. This is the largest Part B increase since 2022, when it rose 14.5%. The Social Security Administration automatically deducts the Part B premium cost from Social Security benefits for most Medicare recipients, which means that a bigger Medicare bite will result in smaller monthly checks. And this is the part that most people miss: the impact of rising Medicare Part B premiums on Social Security recipients with low benefits. If the COLA rises by 2.7%, which is in line with the average 2.6% increase over the past 21 years, and Medicare Part B increases by 11.6%, those with the lowest Social Security benefits will hurt the most. As Johnson notes, if the COLA in 2026 is 2.7%, a Part B premium jump of $21.50 would take the entire COLA of beneficiaries who receive around $800 or less. This is especially the case for individuals who receive a low Social Security retirement, spousal, or widow or widower's benefit. So, how is COLA calculated? The Social Security Administration bases its COLA each year on average annual increases in the Consumer Price Index for urban wage earners and clerical workers, CPIW, from July through September. This means that July inflation numbers will be especially important to pay attention to. The index for urban wage earners largely reflects the broad index the Labor Department releases each month, although it sometimes differs slightly. Last month, the overall Consumer Price Index rose 2.7%, and the index for urban wage earners increased 2.6%. But here's the question: how many people receive Social Security benefits? In May, 74.269 million people received Social Security, according to the Social Security Administration. These beneficiaries include retired workers, disabled workers, survivors of deceased workers, and those receiving Supplemental Security Income, SSI. The average monthly benefit was $1,860.64 in May. Now, we want to hear from you. Do you think the estimated 2.7% COLA for 2026 will be enough to keep up with the rising costs of Medicare Part B? Share your thoughts in the comments below. As Maydora Lee, a money, markets, and personal finance reporter at USA Today, notes, the impact of rising Medicare Part B premiums on Social Security recipients is a complex issue that requires careful consideration. We invite you to join the conversation and share your opinions on this topic. 2026 COLA versus Medicare increase. Bad news for low-income retirees. Brace yourself, Just when low-income retirees were hoping for relief, another financial hurdle may wipe out gains before they are even felt. The long-anticipated Social Security Cost of Living Adjustment, COLA, for 2026 promises a 2.7% increase in monthly benefits, aiming to help pensioners keep pace with runaway inflation. Yet here's the twist that's causing concern. Rising Medicare Part B premiums could swallow up the entire COLA boost, leaving many retirees, especially those already struggling, back at square one. But where does that leave people who rely most on these income adjustments? And is this really the best solution to inflation? Let's break down what this means. In the United States, the Social Security Administration, SSA, revises benefit amounts each year through a COLA, designed to ensure monthly payments reflect increases in the cost of living. According to recent inflation data, retirees are set to see a 2.7% bump in benefits in 2026, a modest but meaningful rise compared to the earlier 2.5% projection. For context, prices for essentials like food, utilities, and transportation rose by 2.6% in June alone, contributing to that yearly increase. The Federal Reserve tries to keep annual inflation around 2% to keep the economy healthy. However, as prices soar above this target, the SSA's COLA becomes a crucial lifeline for those living on fixed incomes. But here's where it gets controversial. These extra dollars don't necessarily add up to a better quality of life, especially because the Medicare Part B monthly premium is also going up a lot. According to a June report, the typical monthly Part B premium will rocket from $185 up to $206.50 in 2026, and $21.50 increase each month. That's a substantial jump of 11.6%, and it will be the steepest since 2022's 14.5% hike. This isn't just a technical budget issue. It's critical for everyday Americans making tough decisions about how to spend each dollar. Mary Johnson, an independent Social Security and Medicare policy analyst, doesn't sugarcoat it. It's not uncommon for Part B premiums to absorb most or all of the COLA increase, leaving retirees barely able to keep up with additional expenses like rent or groceries. Who bears the brunt of this financial squeeze? The situation hits hardest for Social Security recipients whose benefits are on the lower end. Johnson points out, if the 2026 COLA is 2.7%, a $21.50 increase in the Part B premium could effectively cancel out the adjustment for anyone getting about $800 or less per month. Consider this. As of May, more than 74 million Americans were receiving Social Security benefits, with the average monthly payment hovering around $1,860.64. This includes retirees, people with disabilities, widows and widowers, and folks on Supplemental Security Income, SSI. But many receive far less than the average, especially the most financially vulnerable. It's important to remember that the final COLA adjustment for 2026 will depend on inflation rates from July through September, so those months will be crucial in determining the exact benefit increase. But with current numbers pointing toward a 2.7% boost in benefits, at the same time, Medicare Part B jumps by $21.50 a month. The practical effect is clear. The medical premium hike may neutralize any real improvement in retirees' finances. And this is the part most people miss. While headlines trumpet a COLA increase, the reality for millions is a monthly check that barely budges, if at all. Many retirees, especially those receiving less than $800 per month, will see the entirety of their COLA increase absorbed by the higher Medicare premium. Even those collecting the average benefit of around $860 are not immune. Their increase may be almost entirely offset as well. Here's the big debate. Is this system actually working for retirees, or are structural fixes needed to ensure that yearly adjustments actually result in more money for those who need it most? Should there be better protections for lower-income seniors when premiums rise, or is this just an inevitable result of rising healthcare costs? Were you expecting the COLA to offer meaningful help in tough economic times, or do you feel frustrated seeing it erased by rising healthcare costs? What's your take on this balancing act between Social Security and Medicare costs? Share your thoughts below and join the conversation. This is where real change can start. With people like you weighing in,